Ladies and gentlemen, thank you for standing by. Welcome to the Nuts and Bolts of Building Early Childhood Systems Through State Local webinar. During the presentation, all participants will be in a listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Monday, March 17th, 2014. I would now like to turn the conference over to Karen Ponder with Build Initiative. Please go ahead.
Hello, everyone. On behalf of the Build Initiative, I'd like to welcome you to the Nuts and Bolts webinar today. I'm joining Gerry Cobb, the Director of State Services for Build and a colleague in creating and supporting state, local, public-private partnerships to improve outcomes for young children and their families. We're delighted that so many of you have chosen to join us today. There were over 700 people who registered from all 50 states and several U.S. territories, and so we know we're in great company, and we hope you find the conversation interesting and helpful. The thing that characterizes the work that Gerry and I have been focusing on is that the state and local initiatives we studied have been written about and are states that there is a formal structure of state and local collaboratives working together toward overall outcomes. So the key is that the state and the local has a strong connection toward getting the same outcomes. We recognize that many other states have a variety of local collaboratives that are doing quite amazing work, but the ones we're highlighting today have a formal structure, a formal relationship between the local collaboratives and a state-level entity and are doing common work. Please know that this is just the beginning of our work in this area, and much more is planned due to the growing interest that you all have demonstrated, and then because of Race to the Top, among other big initiatives. Remember, you can ask questions during the webinar by using the chat function on the webinar page, but know that we can only answer a few of them today because of time constraints. But we will use your questions to plan our future work and webinar sessions. So thanks for every single one of them. Note also that everyone will be muted during the webinar just to eliminate the background noise, make it easier for everyone to hear. Gerry will start our session today by discussing the study and sharing some of what we learned from the states that have done state, local, together kind of work for the longest time. Gerry?
Thanks so much, Karen. I appreciate your leading this webinar today and all the great work that you do for BUILD. My name is Gerry Cobb, and I'm Director of State Services for the BUILD Initiative. Karen and I together conducted several months of research across the country looking at states and the approach that they had taken in developing both a state-level initiative as well as a community-based approach to their work as well. I'm going to have to say this is a real labor of love. We've done this work not only in our own home state of North Carolina, but worked with states across the country and and watched as they've grown to become really strong initiatives in their states. So it was exciting to do this. The research that we did was called the Nuts and Bolts of Building Early Childhood Systems Across State and Local Initiatives. And Toby, if you'll turn to the next slide. And we looked as part of that research at a dozen states that we identified as meeting some key criteria. And in the reminder email that you received for this webinar, there was an actual link to the Build Initiative website that will give you the actual research that we conducted. And then we'll also connect you to 9 of the 12 state profiles that we've developed as well. So you can get not only the broad lessons learned across the states, but also information on each individual state as well. So we hope you'll take the time to look at that. If you've already deleted your reminder email, you'll also get a follow-up email at the end of the webinar that also has that link as well. Or you can go to buildinitiative.org and click on the state and local work. So we picked a dozen states to look at because we felt like they had invested the most or worked the longest or had the most success in taking this state and local approach. 11 of the 12 early childhood initiatives that we looked at had been in existence for over a decade. One of the states actually ended its work in 2013 as a result of a number of political issues. And then a newer state, Washington State, is actually ramping up its efforts at the local and regional level as well, and seeing this as key to the sustainability of their Race to the Top Early Learning Challenge grant efforts. So as you can see on the screen, these are the states that we particularly emphasize in our research. Next slide, please. So in looking at the dozen states, there were several key elements that we identified as particularly important, and you can see those elements on this slide. And I'll talk more about these elements individually and the importance of each one in the success of initiatives in each state. We'll also talk about the major accomplishments of these initiatives and some of their lessons learned. And I apologize if I seem to go fast through this, but I feel like it's most important for you to hear from our state and local participants as well. So I don't want to take too much time with my slides. Next slide, please. So mission and vision was one area we looked at. In the states that we profiled, they all emphasized school readiness in their mission and vision statements. They also took a comprehensive approach, beginning at birth or prenatally and extending through age 5 or age 8, and looking at not just early education or early learning, but comprehensively at health and family support as well. They all emphasized a community-based approach, the importance of local decision making, the need for it to be collaborative, and the importance of working from a systems building approach rather than focusing on individual programs. They wanted communities and their state level entities to think about how at the community level they could develop a plan around what children needed to be successful, what was missing within the community to meet those needs, how to build bridges between programs, fill gaps, braid funding, and to think comprehensively around an approach that looked at health, early learning, family support, and other needs related to young children. State-level entities, as part of their mission and vision, would support and learn from local system building efforts, create new policies to support local efforts, and eliminate state-level barriers, as well as supporting technical assistance to the local level. Not a small job for any of these, as you can tell, and for those of you on the call who are actually doing this work, you know that well from personal experience. All right, next slide, please. So there were a lot of reasons given when we interviewed state and local leaders as to why they took this state and local approach to their early childhood system building efforts. Most importantly, they all felt like they could not be successful if they were simply trying to make this happen from the state level. Children and families are in communities, and the best way to impact them is through a local approach. Communities are so different and are dealing with different geographic, economic, and cultural issues that make it impossible for the state to create a program or a policy that will assure success for every community and every child and family. A state tends to create policies that dictate a more cookie-cutter approach that simply doesn't get results for everyone. These states also wanted to focus comprehensively, so they were creating one table at the community level that was bringing all the decision makers together to focus on the needs and resources for all children from birth to 5 or birth to 8 around all elements of the early childhood system, rather than having individual tables that focused on individual pieces of work, individual programs, individual grants. They also emphasized that it needed to be a partnership between the state and local level, and that the community infrastructure was necessary to build greater advocacy and public engagement around the work. They also saw this approach as emphasizing a public-private partnership. Next slide, please. On this slide, you'll find some key priorities related to governance that were emphasized to us in the interviews we conducted with state and local leaders. As you can see from this slide, the governance structure can take many forms at the state or local level. The states we profiled took a variety of approaches, including both being inside government and outside of government. Creating both a state and local governance structure was seen to be essential to success in the states we profiled. While there are many states that have local collaboratives, they often do not create a state-level infrastructure to support and partner with local collaboratives, and that is essential. We found in our research there were probably 24 states who had local collaboratives as part of the work they were doing, but a key difference was that they didn't have that state-level infrastructure to support the local-level work, and that was seen as very important. For states that didn't have that state-level infrastructure, they were seen as being less effective and sustainable at the local level. They might have some wonderful local collaboratives that were successful, but not across the entire state. And the other point emphasized by leaders in the states we profiled was to design your approach in a way that values and respects what communities are already doing. Learn from their existing work and lessons learned in designing a statewide approach. Another key point we heard, when you're beginning, if the vision is to be statewide, create a plan from the very beginning that will take you to that vision. States that didn't do this really struggled with issues later in expanding statewide, and that's some of the lessons learned you'll see in the actual research as well. Next slide, please. Another key success element was assuring that there's a local voice at the state decision-making table, so that state leaders are not making decisions without getting local input and assuring local representation at state-level policy-making tables. Without that local voice, state leaders are making decisions that may not fit local realities and may actually create more barriers to success at the local level. And one other key point, we talk a lot about local decision-making and flexibility, but there also must be alignment for this to be successful. A common vision, a common approach, common outcomes across the state and across these local collaboratives. Communities will use different strategies, but there must be some commonality as well that connects them all together into one overall framework, allows them to tell a common story, and lets families know what expectations they can have as well from one county or one region to another. Next slide, please. So funding was another key element in the research we did. And on this slide you'll find varying levels of funding at the state and local level. I'm not sure it's turned yet. Next slide, please.
This is Toby. It is on that slide for the participants.
All right, so it's just me that has the problem. Sorry. All right, on this slide you'll find varying levels of funding at the state and local level. And funding ranged in the states we looked at from $1 million to $450 million at the state level, and $5,000 to $50 million at the local level. And this is based on the approach that various states have taken. I really emphasize, though, don't get so focused on these amounts. And for states with limited resources, don't let the idea of 50 million or 450 million scare you to death. In the states that we looked at, and you'll see this in the research, states were at very different places, and they design their approach based on the kind of funding they have as well. Resources are important, but states with less resources can take different approaches and still take this state and local approach to the work. States with limited funding use that funding to support the creation of a local decision-making table that was responsible for developing the Early Childhood Systems Plan and working together to blend and braid resources and raise new funding across their community and region-level partners. Those that had more funds could actually use resources to fund new programs where there were gaps, or to be the bridge funding between other funding sources to help move their systems agenda. And again, they used fundings to create that state-level infrastructure to support local systems building efforts. And again, even if you have limited resources, if you can find a way to support not only the local level infrastructure, but the state level infrastructure as well, it really has to be a partnership together. The other piece that states thought about in their approach was how to bundle together funding to support their community level work, to look at, we have these multiple funding streams that right now perhaps we're granting out in a lot of different ways, but perhaps we can bundle those funding streams together to channel them down to this one local entity that can then use them as the resources to connect together the early childhood system in their community. So that's another thing for you to think about as well. Next slide, please. Focusing on state and local level staffing. I won't go into a lot of detail here. The bottom line is there's got to be somebody leading this work at the state and local level. It cannot be a purely volunteer effort. And so you want to, at a minimum, provide some funding to support at least a part-time coordinator for this work. I think a lot of time policymakers think, oh yeah, we'll create this community collaborative and all these volunteers will do this work together. Well, the volunteers are doing a lot of work. They're coming together as a volunteer board or committee to do this planning and decision making, but there's somebody that still needs to support that process as well, and so staffing is essential. Next slide, please. Technical assistance is another key element that we really emphasize, and I can't say enough about the importance of it. And this was a key difference between the states that have been successful in their local systems building approach versus the states that have local collaboratives but don't have an infrastructure to support that local success. It is a continual process to be supporting local systems building efforts. If this was easy and came naturally, it would be happening on its own. But collaboration is tough. Eliminating turf issues is tough. Understanding systems building is tough. Community leaders need support, and this support should cover the entire gamut, from governance to family engagement to advocacy to public engagement to blending and braiding resources, program development, collaboration, effective communications, every aspect of developing a community-wide comprehensive early childhood system. Technical assistance should also emphasize a peer learning component. Communities have so much to learn from each other since they are on the ground doing this work. And it also creates a greater sense of a statewide network and that we're all working on this important movement together. Leadership is another big element, and states should work to build local leadership capacity. The difference between a successful local collaborative and an average one or a failing one is leadership. Next slide, please. So accountability and measuring results is another big area that we emphasized in looking at the success of different states. Measuring results is one of the toughest pieces in this work if you're taking a state and local approach. How do you measure results and show accountability when every community may be doing something different? How do you tell a story across the entire state when different strategies are being used, if there is no funding, or if your primary purpose is systems building and collaboration? How do you show that leading to child outcomes? States have taken different approaches to answering these questions and telling these stories. Some have done evaluations at the local level and statewide. Some also have local collaboratives report on outcomes within their individual programs and share success stories. One state reports on population-based data and holds every local collaborative accountable to meeting those specific population-based outcomes. Some have done studies of key components of the work. And all of this is based on what is possible in terms of available funding, the politics, and even your infrastructure as well. We have talked about in a number of states how in the early days, it takes a while to show any outcomes, and so you spend a lot of time focusing on the outputs, just even counting the number of children and families that are benefiting in some way or another from the work that you're doing. And for legislators, even hearing those outputs, something that you can more easily attain in those early days of your work, those outputs make a real difference, and it's something that resonates with them in the early days. Next slide, please. As part of the measuring results, another key thing we really say to states up front when they're thinking about this approach is to think about how you're going to measure those results right up front and what it is you want to measure. What are the outcomes that you want to meet, and how are you going to measure that you're moving towards them, and how are you going to determine that all of your local collaboratives are planning and aligning to these common outcomes. And so, as I said before, while we emphasize the local decision making and local flexibility in this work, there's also got to be alignment and a commonality across local collaboratives. And these common outcomes are an important component of that. And so they might be using different strategies to get to those common outcomes, but those common outcomes that everyone is being held accountable to are used to tell the story and to show how you're measuring performance across the state. Next slide, please. Advocacy and public education and engagement is another big area that we focused on and where we saw the difference between states. And particularly as it relates to local collaboratives. Your local collaboratives can become your local infrastructure for advocacy and public engagement. They're doing the groundwork at the local level, building that buy-in and ownership, and sharing the success stories with the public and the policymakers. When it's time to mobilize on policy and funding issues, your local collaboratives are the entities that make it happen. Press a button at the state level and the troops come out, the emails and the calls begin, visitors show up at the state capitol. Legislators want to support their local district. They want to hear from their local constituents. They may hate the overall initiative and think the resources are being wasted in the rest of the state, but their local collaborative is doing a great job. Sustainability and expansion of your system building efforts must build upon this advocacy approach. And the local infrastructure is critical. And they aren't mobilizing to advocate for just one individual program or just for their particular funding. They're educating and advocating for the overall policy agenda, for the overall work you're trying to do in your state to create an early childhood system. And like everything else we've talked about, technical assistance is needed to support your local collaboratives around advocacy and messaging. And this is another important role that the state level infrastructure plays as well in providing not only that technical assistance around advocacy and public engagement, but creating the common messages that community leaders can then tailor and customize to their particular area, and creating tools that they can use as part of their advocacy approach as well. Next slide, please. So I'm not going to go through this whole list of major accomplishments, but what I'll say is in developing this list, we went through the list of states that we had profiled as part of this research, and there's not one accomplishment on here that some state is not meeting in one way or another. And so you look at this impressive list of achievements, and it's, why wouldn't everybody want to take this approach, and why wouldn't every state legislature want to invest in it? I guess that's my myopic opinion anyway. But these are all achievable with this kind of approach and really shows what is possible. Next slide, please. So these last couple of slides are just, we asked the state and local leaders that we profiled to share with us their words of advice to other states and communities that are taking this approach. And these are some of the words that they shared with us, and we go even deeper in the individual profiles and in the national brief as well. But first of all, it takes time. Think long term, that there is no finish line, which sounds a little disheartening maybe, but this is a long-term process. You've always got new children and families coming into this work, and you have to think in terms of the long term. Dedicated resources are needed. All of the elements that we've outlined as part of this presentation should be incorporated to be successful. So don't just pick one or two or three or four and think, oh, okay, well I've done these, I'm done, we can be successful. You really need to think in terms of all of these elements. Building strong leaders is essential, and it's all about leadership. Involve parents as much as possible in the developmental and the implementation process, I should emphasize. State planning should always incorporate local level input and involvement. And next slide, please. Some communities have been doing this work for a long while. So if you're just getting started, look at the landscape and what's already going on in your state and design your approach in a way that values and respects what they're already doing. Celebrate each step along the way. And we find people get their nose to the grindstone and are working so hard, and they're so focused on what they haven't done that they forget to look up and celebrate as an organization, as a community, as a state, the amazing things that they have already accomplished. And so don't miss out on that opportunity to celebrate and re-energize yourselves for the next phase of the work. Coordination and collaboration at all levels are essential. Also, this is not a program or a project. It is a system building initiative that is bigger than an individual program. And people don't always understand that. When I had somebody editing our brief after we finished it, and she kept changing the wording to say program or project. I'm like, it's not a program or a project. This is so much bigger than that. But people who don't understand will try and narrow your scope, and don't let that happen. Create a balance of local autonomy and statewide alignment. Create a sense of a statewide network moving together towards a common vision. We rise and we fall together, and always remember that you want to reach out. If you're a local collaborative, reach out your hand to your partner next door, because you are only going to be as successful as every single one of them is. You're only going to be as successful as the statewide work is as well. So I really emphasize that. And thank you very much, and I will turn it back over to Karen. And next slide, please.
Thanks, Gerry. And of course, there's much more information as well as the detail in the state profile. So we'll send another link to that. We'll also send you the slides. Several people have asked if they could have copies of the slides. So we'll send that information as well. Now I'd like to introduce you to several people who are joining us as panelists today, who are the real champions of this work across the country. Regretfully, Nadine Basha from Arizona had challenges with air travel and is actually mid-air as we speak, so she will not be joining us today. We couldn't quite figure that one out. But I'm very pleased to introduce Karen Potts, who is Executive Director of First Five Commission in Siskiyou County, California. Siskiyou is a rural county in the northernmost part of the state. The First Five Siskiyou Commission was created in 1999, and Karen has led that work since its beginning. I'll also like for you to meet Eleanor Mattern, who is Program and Operations Support Manager at the First Five Association of California, located in Oakland. The First Five Association supports the work of local First Five commissions across the state of California, and Eleanor plays a key role in responding to the needs of the local commissions. Chris Myers is the coordinator of the Greater Roanoke Valley Smart Beginnings in Roanoke, Virginia. The Greater Roanoke Valley Smart Beginnings was formed in 2007, although they had worked as a community for more than 2 years prior to that. And this work continues to be strongly supported by the United Way. Donna White is the Deputy Director of the North Carolina Partnership for Children, the Smart Start Oversight Agency in Raleigh, North Carolina, which was created in 1993. Donna's responsibilities include programmatic responsibilities as well as quality assurance, evaluation, and community development. Cindy Watkins is the Executive Director of the Guilford County Partnership for Children in Greensboro, North Carolina. Guilford County has 2 large cities, Greensboro and High Point, and then quite a few rural areas, and was created in 1996, the partnership. Cindy has also helped to create and manage 2 other Smart Start partnerships in North Carolina. Julie Coffey is the Executive Director of Vermont's Building Bright Futures, located in Williston, Vermont. Building Bright Futures was created in 2001, and Julie's organization supports local Building Bright Future coalitions across the state, and it also serves as the Early Childhood Advisory Council for Vermont. Linda Leonard is our final presenter. She is currently Director of Community Development for South Carolina's First Steps to School Readiness statewide initiative. First Steps was created in 1999, celebrating its 15th birthday this year. Prior to relocating to South Carolina, Linda worked in 2 North Carolina local partnerships, one as Executive Director and another as leading and supporting the community to be good advocates. So thank you to share what you've learned in this work. And we'll start by talking about governance. In 1993, we were lucky in our state to have a governor, and that's North Carolina, who made early childhood his #1 priority. And because of that strong support and vision, Smart Start was created. With its state, local, regional model approach, it was chosen because we knew that what we had done previously was helping children, but that we had a long way to go to get the outcomes for all children in our state that we wanted. So counties were invited to respond as a county or to join with other counties and become a regional partnership. North Carolina has a very strong county system of government, so most counties joined as individual counties, although some collaborated across county lines and are very strong regional partnerships. The state-level partnership, which is the North Carolina Partnership for Children, was created in legislation as a nonprofit public-private partnership to both administer Smart Start funding, hold accountability, and then to also provide technical assistance and support to the local partnerships. Each local entity is its own nonprofit. We like to think of Smart Start as a locals up, top-down model, and we know this model works because local communities inform the work of the state board and staff, and both the North Carolina Partnership both supports the local work and requires certain performance measures to be achieved. And along with other state and local partners, children in North Carolina have higher quality care and education and health outcomes, and families are supported and included as leaders in ways we could have never achieved without the state and local communities working together toward the same goals. Karen, I'm going to turn to you because the first 5 California model is different from Smart Start in that the county collaboratives are totally independent from the state organization. What are some of the things that you think should be considered from the local level in creating a state and local early childhood systems model?
Thank you, Karen. I think the most important thing to remember is that there is that flexibility to truly create a local model. And so when an organization works with, when these systems come into the county, I think it's essential for the systems leadership to be very intentional with their planning and partnership building, and understand that systems building takes time, commitment to truly serve the entire county, regardless the size of the community or funding limitations. Someone had a question about how our family child care providers included in these systems, and my response to that is if you truly believe in creating local control, local systems, then you create models that support this. Some lessons learned in our systems building in Siskiyou County is it's essential for the leadership to really listen, communicate, and be very proactive in building relationships with non-traditional partners, including those that may not be part of our early childhood communities. Because what this does is it really mobilizes the community at large to make children a priority beyond the life of the funding the menu of fundings that come into a community. Another lesson learned through our process of establishing our community-based systems was to go slow in building the systems and to establish strong partnerships, and go beyond business as usual in your process.
Erin, thank you for that, and I want to follow up with a question. I know you've got a million of these, but can you give us one real-life example of something that worked for children and families in Siskiyou County because you, through your local First Five work, had the ability to create a local strategy to address the challenge?
Probably our greatest example is being able to say that we're able to provide programs and services, high-quality programs and services in 20 communities throughout our over 6,000 square mile county. What we did was we established 10 family resource centers. These were grassroots organizations that have now become nonprofits that provide services not only for children birth to 5, but they also provide support and other prevention and early intervention services throughout their communities. We can say that our smallest community, which has a population of 90 families, those children in that community receive similar services as the children that live in a community where there's 7,000 individuals. These nonprofits have become the key for our service delivery models. And when we think beyond our funding source and when we think beyond just First Five, we can really make a system of investment for children a priority.
Thank you so much, Karen. I'd love to hear more about the Family Resource Centers because I know what good work you've done there, but our time is fast slipping away. So I'm going to move on and talk for a minute about technical assistance. We learned from our study that the success of state and local initiatives is highly influenced by the technical assistance and support that locals receive from the state level. Eleanor, you've helped to create a technical support system for the First Five Network in California through the formation of a membership association for local First Five agencies. Tell us a bit about this approach, and can you mention a few of the ways you carry out your work with First Five county commissions in a very large and diverse state?
Thanks, Karen, certainly. So to start, I just want to briefly frame what this work looks like in California. As you all know, California is the most populous state in the nation with over 500,000 births each year. And so young children and their families here have an incredible diversity of needs. You just heard from Karen Potts, of course, talking about rural communities. We have urban Los Angeles, migrant farm worker communities, you name it. And so First Five commissions are funded by a 50-cent tax, which is invested via 59 commissions statewide, so into 58 counties and 1 state commission. And so our association is funded by membership dues. Since the beginning of First Five implementation, which was 15 years ago, so similar to South Carolina, the association has served to bring county commission staff and commissioners together to foster that peer-to-peer learning and provide technical assistance. And we've had to focus on cross-county learning because prior to First Five, there was very little focus on interdisciplinary learning or shared practices in our state. And so service delivery across the state was very siloed, which meant that there wasn't any sort of technical assistance platform to build on. First Five also changed the way in which local government engages in early childhood issues. So the statute says that we need to be consumer-oriented and include parent voices and utilize advisory committees. And so our TA has focused on building these approaches as well. And so I'll briefly tell everyone about the technical support system that we've created. It factors in county geography as well as size to help counties plan and implement services. So we convene in-person gatherings, which really focus on the peer-to-peer learning that Gerry commented on earlier. We offer quarterly association meetings as well as summits for First Five staff. In addition, we provide regional support. And so we focus on targeted technical assistance for the 20 counties with the smallest populations. And then we have regular regional meetings for executive directors as well. And so those are convened by the region with First 5 Association staff attending and supporting as needed. We also focus on TA by topic area. And so we convene committees. Those meet monthly by phone because, again, it is such a huge state. And we have representatives from each region to ensure that we're really looking at all the needs of our different regions. So we have 5 committees focusing on advocacy, evaluation, communications, and programs, and then the fiscal side as well. So those are really key for the peer-to-peer learning as well. And then in addition, we have regular e-newsletters that are pushing out pertinent information and updates and technical assistance opportunities. We do webinars on timely topics, and then we also do ongoing assistance on a case-by-case basis. So that's a little bit of a snapshot.
Thank you so much, Eleanor. And boy, it's clear with everybody I hear that we've planned about half as much time as we need for this entire session. It's so dense with wonderful information, so you know we'll follow up. I want to hear a little bit from everybody else that we had engaged today. So, Chris, you are the recipient of technical assistance from the state, and I'm curious, what are some of the approaches that have been most helpful to you in your work in Virginia?
And Karen, this is Gerry. Just so we go to 3:30, so you still got some time.
Okay. I'm still feeling like we don't have near.
Okay.
Thanks, Karen. This is Chris. Yeah, there have been many, many things that have been helpful and at different stages. This is my 4th year now in this position, and things that have been helpful all along the way. But a couple of the pieces that I think you were hitting on as well is that the biggest piece is that encouragement of that collaboration, and beyond, like I heard others saying, not just encouraging the collaboration, but really having someone at the state to facilitate those conversations. And similar to as they were saying, we'll have facilitated conversations planned by phone and in person, and those are just so helpful. And sometimes when I'll see that there's a meeting coming up on my schedule and I'm feeling like I'm really busy and I don't know if I have the time to do that, once we get on those calls and we all talk and share about what's going on, we always leave wishing that we had longer, and I always learn something and find that to be tremendously helpful. And it's been particularly helpful to have, again, that state person to facilitate and think about how those conversations are grouped. So if it were just left up to us, I might only be contacting coordinators that I know or coordinators that are close to me, but sometimes they're organized by, what phase we are in the process, so whether some of us have been around longer with phasing or with funding from the state, and sometimes they're organized by topic. And then every now and then they're in person, not nearly enough, but again, the in-person meetings are jointly planned by topics, and they get our input on what we want to discuss as well as some guidance in some topics. And so it feels very open as well, and it's not just the state facilitating a conversation on a topic, but really asking for us to share what's working, what's not with each other. That's tremendously helpful. In fact, we have an in-person meeting on Wednesday, so I'm looking forward to that. The other piece that I heard you all talking a lot about was the leadership and training of leaders. And so we recently, this year, the state helped put together a leadership institute here in Virginia. And so we met, I believe, 5 or 6 times across the state. A couple of those meetings were statewide, where we all came together, and then they divided the state in half. And so those were really all-day trainings, really geared towards what makes effective leaders, and again, some cross-sharing, but helping us learn more about things at the state level that we needed
to be aware of. And so those have been very helpful, as well as the things that you mentioned, things like webinars and different trainings on specific topics, like one focused on developmental screening and one focused on kindergarten readiness assessment that we don't always have to participate in, but they're offered to us, and we can sort of pick the ones that apply to the work that we're doing based on that moment. And then the last one just is, sometimes it's obvious, I guess, but it's so helpful to me at the local level to have some really quality resources to use. So things like even our state has an interactive map on their website, and knowing that I don't have to create all those fancy tools, but that I really need some high-quality resources to share with our business leaders and to document not just what's happening here in Roanoke, but to compare what's happening across the state, and having different templates for marketing, PSAs, even having just documents that help guide some local discussions. So one of the ones that we used recently came out of the state called the Preschool Puzzle to help us really think about all the different parts of preschool, and it came not just with information for the leader, but with discussion guide questions that, again, just helped me really focus on the types of things that I could talk about here at my local community and could kind of pick and choose the questions that were tailored to the needs here. So overall, it's just kind of knowing that we have this open communication and some guidance on what best practices are, but also some flexibility in what we access from the state for what we need locally.
Well said. I want to move now to accountability, and a huge question that states have to answer is how will we measure the success of this collaborative work, and how is the collaborative outcome greater than just individual program outcomes? Donna, would you please describe the approach that North Carolina Smart Start uses to measure and demonstrate county and statewide success?
Sure, Karen. PBIS is our primary strategy to measure and document the impact of the Smart Start Network, and PBIS is an acronym for Performance-Based Incentive System. There was a financial incentive provided to high performers at one point, but funding levels have not allowed for that in several years, but the incentive is still a part of our name. And just to remind everyone of our context, as Karen mentioned earlier, we have 100 counties in North Carolina and 76 local Smart Start partnerships who are all private nonprofit agencies are funded to lead this collaborative work and to fund services based on their community's resources and needs. When PBIS was developed in 2001, local and state leaders as well as state and national experts participated in developing the indicators to measure annual local and statewide progress towards realizing our mission. PBIS is a collection of population-level indicators that track healthy conditions for children and are broken down into the categories of early care and education, health, and family support, though family support has been the most challenging for us. And we also include minimum and high-performing targets for each indicator. The validated data all come from state agencies, so it's secondary data sources, and it's so important for us to use data that's available by county because local stakeholders, including legislators, want to see the impact in their communities, not just a statewide impact. We produce annual PBIS reports for each county as well as county trend data. And the local partnerships use these annual measurement reports to share with their community partners for planning regarding the early childhood system, the programs and strategies the local partnerships should target, as well as to share the successes that are demonstrated. And at the state level, we use statewide data to report to the legislature as well as the public. For the past couple of years, we have begun to provide disaggregated data by age, race, ethnicity, and gender. This has been extremely valuable. For example, the indicator for the percentage of children in 4- and 5-star care is being exceeded, or we're exceeding the high-performing target statewide. However, when you look at the data by age group, you see that in many counties, infants and toddlers are still generally in lower quality settings. And partnerships have used the data showing the differences in indicators by race and ethnicity to launch community conversations about inequities and how to address them. In addition to PBIS, our local partnerships evaluate their programs, and then we at the state level fund third-party evaluation for select programs. Duke University has also been studying the effects of Smart Start and North Carolina's pre-K program at no expense to us, which we are extremely grateful for. And they've shown significant impacts on school achievement and decreased percentage of children in special ed. And the final aspect of our work in this area that I'll share is our current effort with representatives from local partnerships across the state to develop a set of common outcomes to be reported to them that will allow us to show more specifically the successes of each local partnership and the collective Smart Start network. Most data currently reported to us are outputs, and these new common outcomes will be a tremendous complement to our PBIS population-based data. So I'll stop with that and hand it back to you, Karen. Thank you so much.
That's exciting. We'll certainly stay tuned for that. And I may have a follow-up question for several of you later, but I want to ask Cindy. Cindy, I know this from sort of living through it, but when the state sets outcomes that local collaboratives must then achieve, it puts a lot of stress on the local collaboratives to make sure they measure up to those things. Can you give any advice to states that are in the beginning stages of developing their accountability systems from the local approach, the local perspective? What would be helpful for them to know?
Thanks, Karen. Yes. I think that one of the most important things, and either you or Gerry said it earlier, is begin really with the end in mind. So have a really good sense of what your accountability system is going to be when you start out, and that makes everything easier down the road. But I think another thing is really important for state-level leaders to recognize is the different capacity that communities have, whether it's counties or collaboratives, the different capacity they have around ability to deliver services, resources, and the infrastructure. For example, in North Carolina, there are some fairly resource-rich communities that have a really tightly integrated system of human service delivery and support. And just baseline data for PBIS will show these communities or counties really looking pretty good on their PBIS. Maybe not necessarily as a result of anything that the local collaborative has done, just that the community is resource-rich and tightly integrated and able to deliver services and able to provide the data that is required for the databases, for the secondary data sources. And then there are other counties that are very poor and do not have the capacity really or the built-in infrastructure. So their baseline is going to look very different. And so it's important when you're going into this to recognize that people are coming from different starting points. And so when, especially Donna was talking about this used to be an incentive system, it puts a bit of competition in there. And really I think it needs to be more about making sure that communities have the resources that they need and the support and technical assistance that they need rather than being compared to each other. So that's sort of the first thing. The second thing that I think state leaders should understand is the issue of scale. So in small collaboratives or small communities or in small counties in North Carolina, if you're looking to move an indicator or an outcome, and let's say it's around quality of child care, and you only have 5 child care facilities, you're going to be able to move that dial in a way that's much more expedient than if you were in a county that has, 400 child care facilities. So some consideration needs to be given when you're designing your accountability program, not only to the resources that exist in the community, but to the size of the community and how long it may take them to move an indicator. in a positive direction. And Karen, I will happily go to your follow-up question or elaborate on this.
Sure. Can you give me just a couple of things that local collaboratives can do to engage the broader community to work toward achieving their performance measures?
And actually, that's where I was going. Really, the key to all of this is having strong relationships with your community partners, whether it's your health department, your Department of Social Services, your child care providers. You have to have a close relationship so that they can understand how all the parts fit together to create this whole that is a demonstrable sort of accountability piece for the community. But a couple of things that I have learned in the years that I have been doing this work is that very often as the leader of this partnership, I feel that it's incumbent upon me or other leaders to be the convener and bring everybody to our table. And in a perfect world, that would be great. But I have found that some of the greatest successes I have had in getting more community partners together and having them coalesce around ownership of early childhood indicators has been when I have gone to someone else's table. And it might be the chamber. It might be a group of community leaders who are working on a systems of care approach. But when we go to other people's table, that opens us up for possibilities to expand our network. A good example was something called the Children's Executive Oversight Committee that I served on in a prior county, and it really was designed to be about helping prevent high school dropouts. They asked me to be on the committee, and within a couple of years, the committee had become, all of their energy and resources were focused to birth to 5 because they recognized that school dropouts and many of the other negative conditions that children face can be prevented early on. So it wasn't intentional that I brought all these folks together. It sort of happens serendipitously. So it's being aware of the opportunities to be at the table where other people are gathering.
Thank you, Sandy. You've certainly done that well, and we appreciate your sharing those points. I want to think about advocacy for a few minutes. And Julie, sometimes states struggle to find the best ways to support local collaboratives in advocacy and building public will. Will you give us some ideas about the approach that Vermont has taken and what you've learned along the way about advocacy and building public will?
Sure. Hi, I'm Julie Coffey with Building Bright Futures. We stand on the shoulders of giants here in Vermont. I would say in the 1990s and early 2000s, Vermont was just rocking and rolling. I tell you, it had been working across the state for more than a decade to build a unified public-private early childhood care, health, and education system. And so through the years, there were several kind of homegrown collaboratives already in existence throughout the state. And so many of the kind of requisite components needed to support a comprehensive system had already been, to some extent, developed. And there was a wide range of programs and services for children and families. But there was overlap and inequities and fragmentation. And so enough momentum was built because of that strong foundation. And in 2006, then Governor Jim Douglas signed an executive order, and it created Building Bright Futures Early Childhood Advisory Council, public-private, and carried on for a few more years until it ended, and in its place, Act 104 was born, which is state statute, and really pushed by several champions at the state legislature. And in the beginning, it was a dream come true, a state statute calling for the formation of a lead state council and 12 regional councils throughout the state in building a network on behalf of young children and families. And it was equipped with funding to accommodate this, which came with full-time salaries for coordinators throughout the state, salary for the executive director, and infrastructure for the staff. And it, for about a year, began to build. And just as the year eclipsed, then the recession hit. And you can imagine what came with the recession, many tough choices, and the majority of the funding was cut. All 12 positions were cut, leaving the executive director and part-time staff with it. So it was utterly decimated. And yet, from 2011 to present, despite the lack of sustainable funding and the funding and support at the state level, despite that, there was a resiliency with these regional councils and the state council to continue. ARA became available, and part of ARA was used to help in hiring a portion of time. So we began to regrow the foundation and build the regional councils, and they maintained and continued to grow despite the funding. And we relied on our advocacy partners. Kids Are Priority One, which is now the Early Childhood Alliance. And we opened our arms to new partnerships that kind of carried the water in helping us advocate, make known our needs, coordinate our efforts, network. And that has continued up to this point. And what's interesting is that about a year ago, when President Obama made his announcement of his support for early childhood, our own Governor Shumlin began to really talk the talk and then walk the walk. And things began to align where the regional councils, I think, began to feel hope again that the state legislature, state leaders, governor was beginning to understand the importance of brain development and the importance of the local voice. Who better to know the local system service delivery than local partners who are very active in involving their legislators. And without funding, mainly volunteer councils over the last several years, they have continued to coalesce and very, very, very uniformly address their needs to legislators. And the voice has gotten louder and louder, and with President Obama's announcement and Governor Shumlin's support for early childhood, the end of ARA came, and then Race to the Top RFP came out. And because of our governor and his top-level leadership who have been hearing for years the mantra, we need a statewide network, we need local partnerships, we need to build a system to support young children and families. A good chunk of that project, the Race to the Top project in Vermont, was dedicated to empowering local regions, in essence reinvigorating Act 104 and the statewide network that had come into being in 2010. We were able to put that into the application along with a data system that would, similar to what you've heard about data from other speakers, continue to inform our work. And lo and behold, we find out in December of 2013 that Vermont was one of the chosen states. And so I present this information at a very, very opportune moment for Vermont. We're very excited with our governor and his recently unveiled early childhood framework. We have a very, very important moment in time to make the most of the Race to the Top monies in reinvigorating the network, in messaging to our legislators the importance of early childhood, and because of our advocacy partners who have been very involved with the unified message, our philanthropy has heard the message loud and clear. And philanthropists in Vermont have banded together as a sort of collaborative, and they have funded what will be a multi-million-dollar 3-year campaign to raise public awareness and eventually really impact how we make decisions. We hope it'll end in significant funding for early childhood. And the campaign is being hosted by our philanthropic partners. And together with philanthropy, this public awareness campaign, the state council that exists, which is a nonprofit now, I didn't mention this earlier, but once our funding ended, we became a nonprofit. So we're kind of a hybrid, governor-appointed state advisory council, but also nonprofit organization able to raise funding. Now that we have these pieces in place, we hope that based on what happened in the past in the recession and how government reacted, that we're set up this time to be more resilient when the tough economic times come again, and we'll be prepared. And the public awareness campaign, it's dependence on the regional councils that'll now be reinvigorated with funding and deepening our relationship with the state council and the support of the governor and the president. We're very, very hopeful for Vermont.
Thank you so much. You know, Vermont is a testament to resiliency, Julie. We went to Vermont in the early 90s when you all were leading the country in health initiatives and learned from your work, and it really helped to inform our work in 93, 94. So you really have a lot of amazing leadership and have had through the years, but I think your example is a perfect example of staying the course no matter what, and doing the advocacy work that it takes to reinvigorate the days ahead. So thank you for sharing that. We may have another question for you if we have time at the end. Linda, I know you are working for First Steps now, and you also have deep experience in managing local collaboratives in 2 other places. From the local perspective, what can local collaboratives do to advocate for children and for their local and state work? And I know that's a wide open question, but I know you'll narrow to make the right point.
Well, I know you have actually a follow-up question for me as well, and just wanted to kind of combine those two in the interest of time since we're running short. But wanted to thank you all for inviting me to participate and talk about my very favorite subject, which is advocacy. I have been serving at the local level and have recently taken a position in South Carolina at the state level. And one of the first projects I have worked on has been about building advocacy at the local level. South Carolina just held recently its very first Steps at the State House Day, where more than 800 child advocates came from all over the state of South Carolina to let the legislature know how important early childhood is in our communities. It's a very exciting process, and advocacy is really so important. And it's also important to remind your local people that advocates aren't just about getting funding from the legislature. It's also about building systems and community energy around this work. And so you want to build a grassroots advocacy support network in your community to build enthusiasm and energy around the work, so that when people are making decisions at those, say, high school graduation task forces that Cindy was talking about earlier, that they are thinking about not just those who are older, but are also thinking about young children and how important it is to impact their lives. So it is a very, very important piece. It's very important for the state organization to provide some training and some core messaging. It's kind of a piece of work that a lot of people are nervous around because they feel like advocacy is an absolute no-no. But the truth is, it's about educating people about the work that you're doing and helping them understand the importance of it when they are making decisions in their own communities or at the state level. So if you consider it to be a real education process, that's super important. It's also important to not just talk about advocacy during periods of time when your legislature is in session. It's important to talk about it all the time. It's almost too late during a legislative session, I think, to begin to develop those very important relationships with your state leaders. You need to reach out to them on a regular basis, and it's important to provide them with some type of a job around the work that you do. One of the things that I remember in North Carolina is I had a great relationship with our Speaker of the House, and was able to get him to just pick up the phone and call me whenever he needed information about a subject. And I again didn't hesitate to call him because we had gone through and developed that relationship. The relationship can be built in a variety of different ways. It can be certainly inviting people to events or hosting events that are around specific issues related to children, but also giving them an opportunity to be engaged in the work that you're doing. So maybe participating in a site visit with a child care program or a high quality pre-kindergarten classroom and allowing them to perhaps read to those families. It's also very important to really reach out to your local constituents, the people who are actually receiving your services, and make sure that they are getting, that they are also being given that opportunity. I'll tell you, in North Carolina, the people who were probably my largest advocates were these parents who had just never realized that they had an important voice to share. And for them to be able to share their stories with legislators. And I had groups of families that participated in our events over and over again, and were able to share those stories and sometimes develop relationships themselves with some of these legislators. So it's very important work, and I'm going to cut off now so that we'll have time for some additional questions.
Thank you, Linda. And we do have a lot of questions. I'm going to answer the first one. Somebody has asked if there's a state that has done particularly interesting work on family child care, and I just want to mention that Michigan has done a lot of work in this arena, and we can send you a link to something about that work, so if you want to make more contacts, you can. So Gerry, let's include something about that in our follow-up document. And then we have a question about the role of research and data, and both how important that is, but what is it that we've used in terms of research and data, and how has that made a difference? And Donna, is there anything you want to add about that, or maybe somebody else on the panel?
I do think that using some of the research and data and showing impacts has helped us stay alive at certain points of time over the last few years when we have either been under attack or questioned about the value of the Smart Start system. And in tough budget times, it's critical to, and even now in North Carolina, there's a lot of focus and question about the results and appreciating the systems building and the collaboration, but show me the results. So I think it's absolutely critical from our perspective and our experience.
And one more question that was for you is what common outcome measures are being developed? Can you give us, somebody wants just a little clue about what you're thinking about that?
Yeah, we are, for the common outcomes that the local partnerships will be reporting to us, we actually have representatives from all across the state in local partnerships planning with us. They're actually meeting today and focusing today on the family support outcomes. So we have family support, health, and early learning or early care and education outcomes. And some of the outcomes are similar to or the same as the population-based outcomes, but we are matching them to the service that's provided. For example, in our performance-based outcomes, one of the things we look at is the average star rating of child care centers in each county. And what will be one of the, this is still very draft because we haven't finished our planning process, but one of the draft outcomes that we're looking at is local partnerships reporting to us any changes in the star rating within a certain time period after they had provided technical assistance to the center. So we can see if there's a linkage between the interaction of the child care center with Smart Start in addition to the general population outcomes. And so we're also in early care and education, we're looking at the program level, the teacher level, and the child level. And in family support, we're also looking at both the parent level and the child level, as well as at health. In health, we're so far primarily looking at the child level. Is that helpful? And we're happy to share once we've finished this process. I'll be happy to send those to Gerry, and she could send them to anyone who's interested.
We certainly will be staying tuned for that. Thank you so much, Donna.
Sure, we're excited.
I know. It's been such a process. It's been interesting to watch it unfold, and that's thrilling. Eleanor, we have a question for you. What are some of the areas that Local First Five seem to request the most help with? So, are there areas where more research and support are needed for your locals?
Sure. So one of the interesting things that come up for us is, again, the difference in size between the county commissions. And so we have offered summits over the years and eventually found that offering different tracks for different size counties wasn't quite enough. And so Karen Potts and Karen Ponder were actually able to join us last fall for our first ever Small County Summit. And that gave counties with smaller populations a chance to come together and do peer-to-peer learning in a way that really resonated, and sharing those tips. In particular, communications and advocacy and evaluation have been very important, both for those small counties as well as all of the First Five networks. So those are certainly some of the key things that commissions are focusing on.
Thank you. Very, very informative. I also have another question about sustainability. So somebody has asked the importance of having a data system. What role does that play? And then what has led to your sustainability? Because of most of the states that we've looked at, one of the key things was they have sustained for some up to 20 years. So what has led to that? And I'll just let the folks on the panel, or Gerry, anybody that wants to answer that, jump right in.
Karen, this is Julie with Vermont, Julie Coffey, Building Bright Futures. I just want to say really quickly that I cannot underscore for any of our listeners how important data can be in legitimizing, really adding credibility to the work of local and statewide partnerships. We, a couple of years, began development of an online data indicators platform, which allows viewers to look at relevant data, really important data that we had picked out, integrated into a system with visualizations that really offer to the viewer stories behind the data. And that has been the ammunition that local collaboratives, grant writers, legislators, anyone has really needed to tell their story and put across to those they're trying to win over how young children and families are different and their particular needs. It's been hugely beneficial and important.
That's been my experience too. It's nice to hear it from you. Anybody else want to add anything?
Karen, this is Karen Potts from Siskiyou. And what I would say is that just as you're planning systems around whatever the initiative, I think it's as important to understand and clarify with partners what does it mean to sustain a system as a first level. I think when oftentimes when we think about sustainability, we think money, and it's far beyond that. And so I think part of the measurement of sustaining, in our case, sustaining our family resource centers, it was to identify a common definition of sustaining our local family resource centers, and really thinking beyond grants and beyond public funding sources, and looking at sustainability as a community initiative, essentially. So I think it's extremely, first and foremost, extremely important to understand what does it mean to sustain a system, create a local definition of this, and then build champions that are not your traditional champions. You know, build champions from your board of supervisors to the local business owner, chamber of commerce, the other nonprofits, in addition to the agency partners to support the system that you're creating or nurturing within a community.
Thank you, Karen. Somebody has asked, is legislation and legislative support necessary to create a comprehensive system? It seems that most of the initiatives we've highlighted have some kind of legislative support. Just curious if anybody wants to jump in to answer that question. Maybe
in
not.
First Five system, this is Karen again. I would say that what Proposition 10 did for California was essential to see what has happened 15 years from the time that it passed. So legislation is the foundation, in my opinion, of the importance of early childhood investments. Yeah.
It's also been the foundation here in North Carolina as well. I would echo that. This is Donna.
Is there anybody who has done it without legislation? I know that Arizona First Things First has a ballot initiative, which is a different funding source, but then the statewide organization and other things are in law. So is there anybody that has done it without legislation? I'm not thinking so, but I could have missed it. Okay, so I guess, yes.
I'm sorry, this is Cindy. I just wanted to make a comment based on that. In that in Guilford County, I've been working with quite a few philanthropists who really want to figure out how to not only address early childhood issues here, but have policy changes to more firmly secure the funding that we have in our system. And what they're always saying is there will never be enough private money to take care of the needs of young children. It really does have to be a partnership. So I can't imagine how this might work without some legislation that supports it. That seems to be almost foundational. That's not to say you shouldn't start doing something, but foundation leaders and business leaders will quickly tell you that it's not something they can take care of alone.
Right. And so what you start doing is what many states have done is you build the momentum for a bigger initiative that has to have some kind of statewide support and legislation. So we have a final question, and I want to give everybody 30 seconds to answer it. Somebody has asked, what do you wish you had known from the very beginning that you know now, but you didn't know then? And any one of the panelists can answer first, but I would like to hear from everybody.
Just one?
I know.
This is Eleanor from First Five Association in California, and I can start off. We have learned in 15 years that we don't need anywhere near as many consultants as we thought we did. So our staff on the ground are the experts. So that's certainly learning for us.
Wow. Perfect. And let me just add that most people probably don't know this, but Eleanor and Mara Kenny are the only two staff people, I think I'm right, Eleanor, at the association.
That's correct.
And they support an entire humongous state, which speaks to the skill and abilities of those two individuals. But I think it's very important to note that how effective they have used the knowledge from the locals to inform others as part of the way they operate. Okay, who else?
This is Karen. I would echo what Eleanor said, and then also I think that remembering to not underestimate the importance of relationship building before asking for partnerships. It's just, I think people tend to want immediate results, but the reality is the relationships, the building trust, and the connections takes time, and make that your primary investment. And find ways to make relationships with those that you go, ooh, I don't want to answer the phone when they call me. Those individuals, those organizations are as important as the organizations that we have easy connections and easy relationships with.
Very well said, Karen. Who else?
This is Cindy in Guilford County, North Carolina. I would say be prepared to be very resilient. Somebody said that earlier, and I can't stress it enough. This work is really hard, and it takes everyone's effort to be all in making things happen in local communities or at the state level. So I think I wish somebody had told me early on that this probably doesn't get a lot easier. You'll always be trying to figure out how to make it bigger, how to make it better, how to make it stronger, and that you really just have to be resilient and unrelenting in your efforts.
Wow, well said.
This is Donna in North Carolina, and I echo Cindy's comments, and two investments I think that I think the people that were here in North Carolina early on really did a fantastic job in building Smart Start. I think the investments that we've learned over time that are key are really investing in leadership, and at the local level as well as at the state level, and in data systems.
Oh, wow. And we wish we had more time to hear about your leadership work, Donna, because it seems amazing, and everybody would be interested in learning. So maybe on another call, but you're absolutely right. What else?
This is Chris.
Yes.
This is Chris in Roanoke. Again, what you talked about with building the relationships, going slower in the beginning, all of that I would very much echo. And then just that piece of not being afraid to reach out and ask for help, and realizing again that if you're dealing with an issue, somebody else probably is. And I think if I could go back to when I started, tell myself not to feel like, again, I had to make it look like everything was working perfectly, and now I'm much more comfortable admitting that it isn't. So but that can be just as powerful, in fact more powerful, when you start sharing those challenges with others and getting that support back.
Oh, well said, Chris. Thank you so much. Gerry, I think we're at the end of our time.
Are we done? We've got one more minute if I sound like somebody else wanted. Hi, this is Linda. I just would like to say that it's really important to never stop working hard and to continue to raise the bar, to seek improvement in everything that you're doing. Just when you think you don't have enough resources to make it happen, you figure out a new way to do it. And it's so important to just continue working hard, and don't ever leave anybody behind. Always come back and get them.
Wow. I think it's easy to see why the people that have joined us today have done such an amazing job where they are. And we hope that this has been helpful and instructive to you and maybe just underscored what you already knew. But Gerry, I'll turn it to you. Thanks so much.
I just want to say thanks to Karen and all to the, and to the great brain power that was on this call today. It's just inspiring to hear your voices and the wonderful work that you're doing and all that you've learned from all of these years of work and what you share with everyone else. So thank you so much, and thanks to everyone for being on behalf of the BUILD Initiative, and we look forward to working with you again in the future. So have a great day. Bye.
Ladies and gentlemen, that does conclude the webinar for today. We thank you for your participation and ask that you please disconnect your line.